Hello, my dear students. Hope you are all doing fine. Exams are round the corner, and I thought I would cover a few topics, each taking very few minutes. The topic for the day is retinoblastoma. It comes as a short note or an MCQ can be asked. It is a rare childhood malignancy. These words are all important. It occurs in 1 in 16,000 to 1 in 18,000 live births and forms 3% of childhood tumors. I think so far it is very simple. Malignant, 1 in 18,000, 3%. There are two main types. One is familial. That means it is genetic. So there is a mutation in a gene called RB1, retinoblastoma 1 gene. It is rarely bilateral, usually unilateral. It can be associated with other non-ocular tumors out of the eyes. Who imagines that there can be an osteosarcoma that can be associated with it? There can be a soft tissue sarcoma. Okay. So that is familial. The second one is sporadic. So it is non-heritable and it occurs helter-skelter. Radiation increases the risk of a second tumor in these patients. So I think you people will be able to write. Look at this. The eyeball is over here. So there is a tumor and this is the retina which is used for our vision, the lens. Now, the retinoblastoma can be of two types basically. An exophytic, that means it protrudes like a cauliflower, or endophytic, it infiltrates into. Sometimes it remains intraretinal. So it can be within the retina per se, and when they put in an ophthalmoscope, they might not be able to locate a tumor. The tumor is generally creamy white or chalky white. There can be areas of calcification. So it is a large fluffy tumor which is creamy white or chalky white. And there can be specks of calcification that can be seen. Necrosis, of course, is definitely there. It is a rapidly growing tumor, therefore necrosis will be present. Now it is a tumor of the eye. So what can be the clinical presentations? Strabismus, pain, decreased vision, diminished vision obviously will be there. Loss of a pupillary reflex and restricted ocular movements. Obviously, when there is something large inside, it is restricting. Surprisingly, there can be a juvenile cataract or a glaucoma that can be developing in these patients. So these are the clinical features, but we will not restrict ourselves to the clinical features alone. You must mention the type, the gross pattern, and then the clinical presentation. This is extremely important. Look at this. The tumor is composed, it is not difficult at all, just follow what I am saying. It is composed of small, round, uniform cells. So it comes under a group called a small round cell tumor. Hyperchromatic nuclei. All the blue colored ones are the nuclei and they are dark. Therefore, we call it hyperchromatic. True or pseudo rosettes. Look at the particular pattern of arrangement. There are all elongated cells and then in the center there is a lumen. This kind of an arrangement is called a rosette formation. Sometimes there can be a blood vessel here around which there can be the tumor cells. That is called a pseudo rosette. So hyperchromatic cells which are uniform rosettes, true and pseudo. Extensive areas of necrosis. Look at this one. This is the structure. The nucleus of the cell, cytoplasm, and then there is the central lumen. This is the structure of a rosette. There can be a homoright rosette. In the center, there is some filamentous structure of the neurophil. Sometimes there can be flexner intestinal rosettes. There is a central cytoplasmic process around it. So this is a true rosette, whereas this can be a pseudo rosette. So look at this one, a blood vessel around which I am finding the tumor cells, a pseudo rosette. Microscopy is extremely important. These can be asked as MCQs. The complications, diagnosis and treatment. Complications can be retinal detachment, blindness, invasion of the orbital cavity, and optic nerve invasion. And the diagnosis can be made by wide field photography, ultrasound, CT scan, or MRI. These are some markers. If possible, you can remember. SOX2, SOX2, MAP2, neuron specific enolase. These are three markers not of great importance for undergraduates. The treatment will be chemotherapy and enucleation. Enucleation means they remove the entire eyeball itself. We get the entire eyeball as. Thank you.